Hi, this is Dr. Neal Schwartz. In previous videos, I've given you my clinical opinion on both Accutane and oral antibiotics in the treatment of acne. Today I'd like to continue this video series and give you my opinion on the treatment of acne with simple benzoyl peroxide regimens of all types, some of which have been around since the 80s. Let's start the discussion with my opinion of the overall success rate of topical benzoyl peroxide regimens in general. After 2 decades of study, I have found this to be the case. It is my opinion that 30% of all those using a simplistic benzoyl peroxide based routine will find significant satisfaction, whether that be total inactivation or just inactivated enough to be very satisfied. I have found that another 30% will find partial satisfaction, which means that maybe their bump count goes down or their redness comes down a little, but they still remain active. Some of those people who get partially inactivated will be satisfied and others will be dissatisfied, but in this category I would say 30% get partially inactivated. The remaining 40% of people who try simplistic benzoyl peroxide based routines will not get better, they will not find any satisfaction, and unfortunately some will actually make their acne worse and create more wear and tear. So that's my experience in the last 20 years of studying this condition. 30% of people will do great, another 30% will improve but will not get complete control, and 40% of people will either not improve or get worse. And as an important detail, I found this 30-30-40% breakdown to be true of those who are highly motivated and doing the routines as directed. One of the biggest injustices in the treatment of acne is when doctors or companies assume that because a person is not doing well on their benzoyl peroxide regimen, that they are not motivated or using it as instructed. The exact opposite usually happens. Acne patients are highly motivated and highly regimented, and the ones that I'm counting in this 30-30-40 percentile are the ones that actually apply it as directed once or twice a day, exactly as directed. They will still either succeed, partially succeed, or fail, and that is despite all efforts to follow instructions perfectly. Let's now get into further detail and talk about the specific pros and specific cons in a simplistic benzoyl peroxide topical routine. Here are the pros. Number 1, it is relatively inexpensive and widely available. Benzoyl peroxide topical treatments have been available in drugstores since the 80s in all strengths, percentages, and forms. Number 2, as mentioned, they bring significant satisfaction to 30% of people. Number 3, they also bring partial improvement to another 30% of all those who try it, which can be seen as a pro or it can be seen as a con. We'll put that on both lists. Partial improvement can be good, or partial improvement can be frustrating, depending on what your goals are and what your threshold is for satisfaction with your skin. Number 4, these simplistic routines offer patients and clients the ability to take care of their own well-being. They have a sense of claiming their lives, and in a lot of ways it's a pro that they can do it by themselves, learn new skills, and take care of their skin. That always feels good when you're not dependent on a practitioner. So when they work, we'll say, for number 4, when they work, it's a pro that you can do it yourself. Now, let's talk about the cons of a simplistic benzoyl peroxide based routine. Here they are. Number 1, many people are either allergic or just highly sensitive to this ingredient, and thus they are one step closer to hopelessness when they try these very popular topical routines and they have a reaction that inhibits them from using them. Number 2, a simplistic benzoyl peroxide routine can bleach your clothing, can bleach your pillowcases, and can bleach your sheets in ways that can distract you from wearing whatever clothes you want, especially if you're treating your body or your neck area. Number 3, 40% of people using a simplistic benzoyl peroxide routine will either not improve at all or get worse and create more wear and tear all on their own. An additional 30% will only partially improve on these simplistic regimens. And if you're goal-oriented into getting total inactivation, this partial improvement will not be satisfying. And if anything, it may contribute to a cycle of defeatism and hopelessness. Despite any claims to the contrary, these simple benzoyl peroxide routines have tolerance and resistance issues. While some may argue in a lab there is no resistance to benzoyl peroxide, anyone who has had acne for 5 years knows that the skin creates tolerance to any active ingredient, certainly to benzoyl peroxide. It's similar to the movie Jurassic Park when they say, life finds a way. That's true for the bacteria on your face and for the tolerance of your skin to certain topical preparations. The skin is constantly becoming resistant and tolerant to anything you put on your face, and it gets accustomed to it and reacts differently on week 3 than it does on day 1. And so anyone who tells you that benzoyl peroxide has no resistance is speaking from a study that may have been done in a petri dish. But we know clinically, as acne sufferers, that benzoyl peroxide does get weaker as you continue to use it. The potency changes. And a simplistic benzoyl peroxide regimen does not take into account this obvious resistance. Whether they're being sold on infomercials, a spa, or online, all of these products are embellishing their results. They have not addressed the real success rate or lack of success, and they're claiming to help almost anyone with these simple routines. This is the real injustice. It's not that any of these benzoyl peroxide routines are scams or that they don't work for some. It's just that the marketing has been embellished for 30 years. It's this embellishment that has created the disillusionment and the defeatism and the skepticism and the apathy and the depression and anxiety that acne sufferers face. I meet clients after they've failed multiple benzoyl peroxide routines, and their anxiety is very high. The reason their anxiety is very high is because whoever sold them these routines did not tell them that there was a 70% chance that they were not going to be satisfied fully with these treatments. Had they been told that on day 1, they would enter a simple benzoyl peroxide routine with a much different mindset. The mindset of, let's see if I can beat this, versus, I know this will help me. When you have this false hope that I know this benzoyl peroxide routine will help me, and then it doesn't, it creates the emotional trauma. And so that's what I've been witnessing for the last 20 years, is repeated emotional trauma eventually chips away at an acne sufferer's soul until they become completely disillusioned, completely apathetic, and essentially retire in the fight against acne. So, as a con, it must be said that the way these simplistic benzoyl peroxide routines are being marketed is one of the major injustices in the treatment of acne. Besides allergies and high sensitivities that we mentioned prior, simplistic benzoyl peroxide routines can also cause subtle irritations and texture changes that are not desired by anyone who is trying to treat their acne. And so some people on these simplistic routines trade acne for irritated and roughened skin. It's not necessarily because benzoyl peroxide is irritating, it's because these simplistic routines don't really address all of the needs that an acne sufferer has. An acne sufferer needs to get rid of all the bumps without harming their skin at the same time. These simplistic routines do not address this need, and that is one of the cons of them. I said before that one of the pros of a simplistic benzoyl peroxide routine is that you can do it yourself. You're all by yourself to do it, and that gives a sense of empowerment when you win, and that's nice. But this same aspect of these simple routines is also one of the cons, because if you are not seeing a rapid improvement, you are left to your own devices. You have no professional to ask for help, and you're left all alone to get frustrated and to repeat the cycle of failure. This type of failing while on your own definitely contributes to the phenomenon of hopelessness and defeatism. One of the biggest cons of these simplistic benzoyl peroxide routines is the concept that they tell a client to hope and wait, or to put it on your face for 3-4 months and then see what happens. In my opinion, waiting several months to see, quote, results is very dangerous, as acne is a time-sensitive inflammatory issue. So if you're not seeing significant changes within the first 24 to 48 hours, there's a problem with your routine. And if you're all on your own doing these simplistic benzoyl peroxide regimens, you really have no one to talk to about this, and thus you could spend 3 or 4 months slapping this stuff on your face and doing more wear and tear. Another con to a simplistic benzoyl peroxide routine is that some people tend to get, quote, worse before they get better. And this type of worsening before getting better can be very emotionally traumatic for those trying to take care of their acne situation. When you're left with just a product and your own devices, getting worse first and then getting better is very dangerous for both wear and tear and emotionally. So the whole idea that would purposely get worse before better is a con of these simplistic routines. So those are the pros and cons that I've been witnessing for the last 20 years. Now let's talk about benzoyl peroxide in general and how it is portrayed in the marketing machine of the 21st century. Notice when people try to sell you acne products, they get right into this ingredient focus that gives you a scientific understanding of what's going on. All of this science and pseudoscience that you get bombarded with is intended to convince you logically and scientifically that you are choosing the right product for yourself. Like I said, in 30% of the cases, it actually will work as it did in the lab. The problem is, these claims are made in vitro. They are not made in vivo, which is in real life, and thus, people are getting very frustrated with these claims. The bottom line is this for simplistic topical benzoyl peroxide routines. They are widely available, they're inexpensive, and they do help some people. However, they also hurt people, create hopelessness, and leave people to their own devices when they're repeatedly failing. They have embellished marketing and really haven't accounted for their widespread failure rate. They also have obvious resistance despite any claim that's been generated from the lab, and many people can't use them because they're allergic or highly sensitive to them. My recommendation on simplistic benzoyl peroxide routines is this: if it's all you have available to you at this time, it is definitely better than nothing, and you should give it a shot. However, you should give it a shot with the mindset knowing that it may not bring you to satisfaction. And if you come in with that mindset, you won't be as emotionally traumatized as others who saw the commercial and assumed it would work for them. That's my recommendation. It's okay to try them as long as you have the right mindset. And if anyone ever embellishes a simplistic benzoyl peroxide routine, make sure not to let that injustice go unanswered. Now, some of you may be wondering, Dr. Neal, how can you talk about embellishment of claims and all of these issues regarding marketing when you say on your site you're having a 100% success rate? And that's a good question. The reason is because I'm not selling products haphazardly to the masses. I take in every client one at a time and follow their daily participation every single day. When you watch my homepage video, you'll see that the 100% success rate is the case for those who repeatedly communicate with me and articulate their concerns to me every single day. The minimal commitment is 90 days, but the maximum a client has ever taken me to is 58 days. And this client got complete satisfaction after that intense back and forth. So, when I say I have a 100% success rate in the Acne Bootcamp program with those who participate every day, what I'm saying is I'm undefeated with the condition of acne with those people who repeatedly ask me questions and tenaciously chase down the answers to their concerns every single day. I have yet to have any client that's gone 30 days in a row with me, back and forth, articulating question and answer, and still not seeing dramatic trajectory and improvement in their skin. And I've yet to have any client go 60 days without complete inactivation if they are participating every single day. So when I say I have a 100% success rate with good clients, this is not an embellishment. I am, like an undefeated boxer, undefeated with the condition of acne. There is a reason I was able to build that incredibly large video gallery by myself. It's because of the ridiculously high success rate that I'm having, and because I monitor participation of all clients in a time-sensitive manner. Another question this video brings up that I'll address right now. Dr. Neal, you just spoke of all the cons of simplistic benzoyl peroxide routines, but I heard your bootcamp uses benzoyl peroxide also. Do you have these same cons in your program? The answer is no. The Acne Bootcamp program is not based in benzoyl peroxide. It is one of the weapons in the arsenal that is optional. For those who can tolerate it without allergy or sensitivity or irritation or dullness, they may use that in the kit. For those who can't, we use alternatives. The kit has thousands of different options that we use to navigate any clinical situation with acne. That is what we're doing in the acne practice, and that is why it's called the acne practice. This is a practice of navigating around any concern or any resistance or any allergy. It's been done over and over again. I captured all of these resistant and allergic cases in the video gallery. So let's address these cons specifically and how they relate to Acne Bootcamp. One of the cons mentioned was bleaching of clothing, sheets, and pillowcases. This does not happen in Acne Bootcamp. We do not leave these simplistic benzoyl peroxide routines slathered all over our face and body so that they can ruin our clothing and sheets. Another con that was mentioned in the simplistic benzoyl peroxide treatment was that you are left to do this and tackle this emotional condition all on your own. The Acne Bootcamp program is specifically created so that you're not on your own. And in fact, if you do it on your own, you're not really participating in the program. The new video interactive robot, the email system, and the phone are all available to make sure that you are interacting on a daily basis. That is one of the requirements of the program, is to not leave people all on their own to make bad decisions or to emotionally react without taking new action. One of the other cons I mentioned in the simplistic benzoyl peroxide routine was the idea of resistance. The Acne Bootcamp practice has already addressed this concern years ago. If you get resistant to any of the products that are in the kit, there are ways to adjust them. There's thousands of different ways to adjust the whole routine, all of which have been put in video interaction, and you can find out more by emailing if you need, to alter your program so that you don't get resistant to any one simplistic routine. It's a practice, not dependent on a magical routine, that is intended to save a person for life. It's an interactive practice where concerns get navigated and addressed and resolved. In fact, in the Acne Bootcamp program, if you harbor concern for more than 24 hours and don't address it either by the video interactive system, email, or the phone, you're not really participating. So you can see there's nothing simplistic about it. Allergies are common and not a problem. Resistance is common and it's not a problem. Concerns of dryness is never a problem. We fix dryness easily in the practice. Concerns of irritation, never a problem. Concerns of getting worse before better, that's never a problem in the practice. If you have that concern, you want to be interacting every day to make sure that does not happen. In fact, in the Acne Bootcamp program, we're expecting steady improvement within 24 hours. And every 24 hours after, we're expecting continual improvement. So, you can see that a simplistic benzoyl peroxide routine is not in any way comparable to what we're doing in the acne practice. This is a practice that is a product. If you feel that one special product will be your savior for life and you prefer to be a consumer, I would go that route only. If you feel coachable and you feel that there's something to gain in a daily interaction with me personally, then a practice is more what you're looking for. The two are not even comparable when considering approaches to treating acne. In response to the fear of getting worse before better, this does not happen in the acne practice. In the acne practice, you're expected to improve within 24 hours. And if you do not, you're expected to participate, interact, ask questions, and resolve this concern immediately so that you build your trajectory and get better every single day. That's why the participation is very important. In conclusion, I'd like to make a note that simplistic benzoyl peroxide routines have helped many people. While it's 30% of all those who come and try them, that's still a lot of people. And in a utilitarian model, where helping some is better than helping none, these simplistic routines have done their job. Without the embellishment and the poor marketing tactics, they are actually a positive influence in our society. It's only the marketing and the embellishment that creates emotional trauma for those who fail and then become skeptical and disillusioned to all acne treatments. The products themselves, the routines themselves, without the embellishment, are a positive influence in our society. If you're searching for something more than a product-based, consumer-driven product to help you with your very complex and stubborn medical ailment, I would recommend joining a practice. That is my advice for all of those who are continuing to fail. Consider that the failure is due to the fact that you're doing this all on your own. As a side note, if you're continuing to fail while in a good relationship with your local doctor, I will be addressing the success rate and the pros and cons of board-certified dermatologists and family practitioners in later videos. We'll be discussing all acne treatments, including the pros and cons to my boot camp. That will be in a later video as well. We'll be discussing lasers, we'll be discussing estheticians, we'll be discussing everything. It will all be out on the table so that you understand what it is you're coming into before you get your treatment. Just this understanding and just this video series will prevent that emotional trauma of heightened expectations or exaggerated claims. And that is the intent of this video series.